Now it's my great pleasure to introduce Pat Geraghty, Chief Executive Officer of GuideWell and Florida Blue, and he's also the former chair of NIHCCM. Pat is a nationally recognized leader in the movement to reorient healthcare around the consumer. He restructured Florida Blue and created GuideWell to focus on health solutions for the consumer. And now GuideWell is featured in a Harvard Business School case on the model for strategic reinvention. Pat has led numerous consumer-centered innovations, including the acquisition of brick-and-mortar retail centers and also a dive into the delivery of healthcare. As you will hear, Pat believes strongly in the connection between health and well-being and has a bold vision for how innovation can solve the critical issues we face in healthcare. So please join me in welcoming Pat Geraghty to the stage.
Thank you, Nancy. Good afternoon, everyone. So we've heard a lot this afternoon about where health and healthcare is going. I just want to give you a little bit of grounding in our organization and some of the things that we were faced with. I arrived at Florida Blue 6.5 years ago, and we had a very good company, but we were also looking at a lot of transformation that was happening in the marketplace. So sort of the end part of the story is something Nancy just alluded to. The Harvard Business School now runs a capstone case study of our strategy. And for the last 4 years, I've gone up to school there, listened to them pick apart our strategy and ask questions, and then spend an hour in Q&A with the students talking about our strategy and its evolution over the last few years. If you look at the slide we've got up here, when I arrived in Florida, we were a single state blue plan, which is where we can use our cross and our shield. But we created GuideWell, the holding company, because it gave us an opportunity to go outside our state and to do other things. So today, our footprint is significantly larger than it was. We literally are doing business in numerous states across the United States for a variety of things that we do in our business. As a matter of fact, today, we're doing business in 29 states in the United States. We doubled our revenue from $8 billion to $16 billion, and our employee counts have moved from 6,500 to 12,300. So we've got 5 distinct businesses that are producing the revenue for our organization. What we said going into healthcare reform is that we were not going to survive healthcare reform, but that we would thrive in healthcare reform. So let me show you some of the things we've done to do just that. Our organization today, again, $16 billion, serving 5.5 million people in our home state of Florida, but serving people across all of the states that I alluded to. We changed our structure. So if you think about innovation, people can talk about innovation as technology. We looked at innovation as we're going to change the mission, we were going to change the values that we had as an organization, we were going to change how we thought about our structure, how we thought about our operations, and right through to every part of the business we questioned. So if you look at our structure, today, GuideWell, a mutual insurance holding company, has 5 businesses under that company. The traditional insurance company that everybody is aware of, that is a blue company that's been in business for almost 75 years. But next to it, we have GuideWell Health and GuideWell Connect, and we have our latest acquisition, Pop Health. So the Pop Health company speaks just to what we were hearing about a moment ago. We bought a population health business based in Tennessee, and what I truly liked about this organization is they bring healthcare to the home. So chronically ill patients being served in a home setting using technology. This is differentiating, and it was something that we wanted to bring to Florida. They were operating in 8 other states already. Now they're handling a lot of patients in our home state, and we will continue to grow that business across the United States. In our GuideWell Source business, we were handling just the state of Florida for being the Medicare intermediary. Today, we do 12 states we're fully 32% of the federal traditional Medicare contract, and so we've dramatically changed that business. In that one business unit alone, we'll pay $110 billion of claims this year alone. So that's a substantial business and continuing to look to grow. In GuideWell Health, we said we can't just be the 15% of the healthcare dollar, the piece that's the administrative piece, and truly have the impact that we need to have to make the change in the marketplace. So in that space, we now have two staff model HMOs. We bought a multi-specialty practice outside of Tampa, Florida. We created a partnership and constructed emergency medical facilities in Central Florida in the Orlando marketplace. We created a partnership in South America with an organization called Sanitas. And with that group, we created medical clinics in South Florida. So we've dramatically changed what we're doing in the direct delivery of healthcare. So dramatically different. And then in the retail space, we have what we call GuideWell Connect, and we take the things that we do that we think are differentiating in the retail part of our business, and we actually sell that to other Blue plans. So in 6 other Blue plans, they're using some of our retail capability when they go to the individual marketplace. A lot of that is because of the public policy change. When we look at the things like Medicare and Medicaid and the Affordable Care Act, our membership today is dramatically moved to retail purchase membership in our business plan. Fully half of our revenue comes from people who are paying us directly. This is for businesses. If you think about the old insurance model, it was sell to the employer and the employer buys the coverage. Today, half our revenue, more than half our revenue, coming from people who pay us directly. So we are very much in the retail business, which changes the way you think about your customer significantly. Think about what people used to be very frustrated about, and I'm not saying they aren't somewhat frustrated today, but if you were getting coverage from your employer, and the federal plan is different because you have lots of choices. Most employers make a selection for their employees, and that employee then has that choice. Often frustrated by having that choice because it's been made for them. Individuals can move, they have more flexibility, therefore the bar is higher. When we talk about comparing ourselves in the marketplace, I do not use comparators of other Blue plans. In fact, we don't even use comparators of other insurance companies. We try and compare ourselves against the best retail companies out there because that's the space we operate in. When people go to the internet to make purchases, they're not going, oh, that's healthcare, let's give them a pass. Let's expect something less. So we're holding our folks accountable to really looking at how do we do our business in the most effective way as a retail company. So some of the things that are now really powering the way we're looking at the marketplace are depicted on this slide. If you look at the things that are happening in care delivery, we have what we call pods, place of delivery service, where we deploy teams who are working directly in the marketplace that are thinking comprehensively about patients and are looking at all particular options for taking care of people, including helping to move them to a home setting and driving the clinical services to that home so that the patient is better taken care of there. We're actually in a revolution. I agree with the comments we've made, but I think the revolution is both high-tech and low-tech. If you're dealing in the senior marketplace, it is so critical to understand the home setting for that senior. Seniors today, like seniors have been for years, if they fall, that is the first domino in a series of health-related issues. So what's most important with a senior? Going to the home, finding out, do they have grip bars? Do they have shag rugs that are going to lead to falling? Do they have things in the way on their staircase? How do they handle their pharmaceuticals? Do they, because they're difficult to open, throw them in a big bag along with the next one and the next one, and then try and figure out which one they're supposed to take at which time? That's when you get drug noncompliance. That's when you get somebody hospitalized. So going to a patient's home gives you a tremendous amount of information for understanding, do they have people who are with them that can help them navigate through the drugs that they're taking and how their life is laid out within their home setting. And that is actually very low tech, but goes a long, long way to keeping people healthy in the first place. One of the things we said at the start of our transformation was that we would be not an insurance company, although insurance is an important thing that we do, but a health solutions company, helping people navigate through life, keeping them healthy in the first place. And that is a real comprehensive look at the people that we're serving, not merely looking at somebody as we've got a claim to resolve. We'd like to be on the front end of that and help you not have a claim in the first place. So keeping you healthy is something our system, if we can call it a system, was not particularly good at. And it was a void to be filled. And so what you're seeing now is a lot of people trying to figure out how do they play in that void. And I think we're multiple years into reaching out to our customers to do just that. I'm going to keep us moving because I know we're a little bit on time here. I want to talk to you about our Florida Blue retail centers. We literally had a New York Times reporter come sit in one of our retail centers and do, hold it, a positive story about a health insurance company. I'm going to leave her name out of this discussion just to protect the innocent. But I will tell you that this particular reporter walked into our retail center with me, and as we're standing there, somebody walked into the retail center, unrehearsed, trust me, and they walked up to the counter and said, "Is Brad here?" She turned around and said, "Brad, are you asking for somebody by name?" "Yes, Brad takes care of our family, understands our complex situation, and I come in here monthly to talk to Brad." It's personalized service. So people asked me when we open retail centers, I had a reporter run up to me and say, "Why are you opening a retail center? You can do everything you need to do online. This is not the way to go." And my answer was, why does Apple have Apple stores? Right? They can do everything they do online. But what about healthcare makes it actually something that these kind of centers work for? Complex, personal, expensive, and people want to talk to people. So what we did was we went up to Massachusetts, looked at the connector, and found out that people go online and they didn't make a choice. They went offline and tried to talk to somebody to get better advice. So we built our retail centers. So when the Affordable Care Act went live, we then had 18, now we have 21 retail centers across the state of Florida. Last year, 350,000 unique customer visits to retail centers like the one you're looking at. And what people tell us back, 92% customer satisfaction when they engage in our retail center. You can also see a clinician. We'll do a health risk assessment, tailor a health and wellness program for you. 97% satisfied if you see a clinician. So just 1 month ago, our plan received the Blue Cross Award for the highest retention of members in the system. We get the best word of mouth from our retail centers. And we just keep asking the community, what else would you want in this center? So we do senior seminars, nutrition seminars. We lend the space out to charitable organizations. These have become truly community centers, which in a retail world goes a very, very long way. So it's been one of the best things that we've done, and we continue to invest in it. I mentioned before a little bit about our emergency medical facilities and our partnership with Sanitas in medical clinics. The emergency medical facility was driven out of the fact that we had a hospital system who was using their ER as the admitting spot for their facilities, right? You go into the ER, they were admitting well beyond what other hospitals were. So we, across the street, opened up competing emergency medical facilities that were driving a very different engagement with patients. High touch, very comfortable. The waiting time was not like the hospital. People loved the experience, and we started taking patients from the hospital. And the hospital had to change the way they were doing business. So we've changed the whole level in that marketplace by putting competition in place. One of the messages for Washington, D.C. was, It's not just about competition among health plans. It's about competition in the delivery system. If you go across the United States and look at places where there is dominant hospital that's now bought the medical facilities around them, they have the highest healthcare cost in the country. Competition in the delivery space actually drives just the opposite, right? So what we did with Sanitas, this was a South American-based HMO. We had lots of people in South Florida who had immigrated from South America. They knew the brand, they knew our brand. We combined with them, built medical facilities in the South Florida marketplace, which is as expensive a marketplace as you can get. But what that automatically did was drive competition into the South Florida marketplace. 2 years ago, we had 0 patients as we opened the doors at our Sanitas facilities. Today, we have 190,000 patients in those facilities. High levels of satisfaction, much more efficiently being delivered. And the Baptist Health System, among others in South Florida, have taken notice and now are competing to get more efficient, drive costs down, and drive their customer satisfaction up to compete with the Sanitas system. Competition works for everybody. So that's one of the main things we've seen there. Now we talk about the disruptors, and we've had some reference to these disruptors already. I think there's going to be lots of disruptors that are coming into the space. The difference is most people who come in to disrupt healthcare are coming in to do a slice or a wedge or a piece. It's one thing to come in. Healthcare is so huge. It's one thing to come in and say, we're going to do one little piece of healthcare and deliver a solution. The companies like Patrick's and mine, we're trying to solve for the whole community. We're about a mission. We are about taking care of everyone in the state of Florida. So our plan serves all 67 counties. It is actually not our fault that United, Aetna, Cigna, Humana, go down the list, all decided a couple of years in to exit the individual marketplace. We're the ones standing. Centena's in our market. We're serving all 67 counties. There shouldn't be a punishment for being the plan that did it right. We've been in the black every single year of the Affordable Care Act, and we serve 1.2 million people in our individual marketplace. That should be applause from some parties as opposed to, gee, now we don't have options. So we are doing the job in our state, and we'll continue to do that job to take care of people who are desperately in need of care. I'll close by talking a little bit about innovation. This is our innovation center in Lake Nona, which is just outside of Orlando. And we have a tremendous medical community there with all kinds of facilities, from a VA hospital to Nemours to research facilities to a med school. They're all on the same campus. We put an innovation center there because it was the really needed and missing element to this particular campus. And in this center, we incubate early stage companies. We've got companies that are doing things like online mental health. We've got companies that are looking at head trauma and other innovative organizations. So they're early stage. We're investing in these companies. We hope to roll them out and make them the next best thing in healthcare. They've got 5.5 million people in Florida they can serve if they develop something that's truly unique, and 100+ million people across the United States that we could market to other blue plans if we roll out some really innovative things out of this center. So we're very, very invested in our innovation center and in the early stage companies we are working with. The other thing we do here is stage significant multi-stakeholder forums on critical subjects. So far, we've had forums on cancer, we had a forum on mental health, and we're about to have one on opioids in the fall. We bring people from all sectors as well as policy makers together to be in these forums so that people who are making policy or driving policy can hear directly from patients. We think that's really one of the missing ingredients in the formation of policy, and we want to make sure that we're part of that. So as we look at the continuum of what we're about, a mission-driven organization moving all the way across this continuum as you look at it, and our track record in the ACA speaks to our commitment to our community, our putting the consumer in the middle of everything that we do, and making sure that the data and analytics that we're driving support taking care of our members and our customers in everything that we're about each and every day. Thank you.